Good afternoon and welcome to the 23rd Health Sciences Lively Lunch. My name is Andrea McLellan and I'm a co-moderator today along with my colleague Kim Steinle, who is a Director of Subscriptions, Sales and Services for Health Affairs. Kim has the power of the microphone, so if you would like to make comments or if you have questions, please just flag her down. And speaking to the microphone will help capture this for the recording. The Health Sciences Lively Lunch was established many years ago by Ramuna Kabilius, who's with us today. Kim and I collaborated with Ramuna on the content of today's session, and Kim and I are very grateful for Ramuna's experience and expertise as we pulled together the various elements. Thank you from all of us for continuing to make this gathering an annual event. Ramuna will kick off the day with her latest trends in publishing before we move into our panel discussion, which will look at two trends impacting health sciences: diversity, equity, and inclusion, and AI. For our panel, I will begin by introducing the concept of equity budgeting and reflect on budgetary processes in academic institutions. Following this, we will hear from Elizabeth Speer, who will discuss DEI audit processes she implemented in her institution. Unfortunately, Elizabeth is not with us today. She was unable to join us, but we will be watching her slides and we will take questions. A link to the slides will be shared in the chat area following the presentation. Our last panel presenters are Chris Cox and Elias Tzoc, and they are going to look at AI from a health sciences perspective and give us much food for thought. And if you'd like to hear more from Chris on AI, he is part of a panel this afternoon at 5 p.m. So we will pause between presentations for questions, plus there'll be time for discussion at the end. And we have a sign-up sheet that Kim's going to send around. So if there are additional handouts or things to be distributed, or recordings, things like that, we'll make sure that those get to you. So without further ado, I'll hand it over to Ramuna.
We were so organized that I deposited our slide deck and my handout in our institutional repository at Northwestern, and there's a little QR code, and I have some slips at the back. But as goes with trends, at least, things are constantly changing, and I've already found out a few things here at the conference that I wish I'd included. So I'm considering whether to create a post-conference version of my handout. So the word cloud kind of depicts some of the things going on in the past year. And why do I do this each year? It helps me do my job at work. It helps me find out about publisher changes, title changes, journals moving to a different platform. So it informs me at work. It helps me inform within my department and library. Occasionally, because we report to the Clinical and Translational Sciences Center at our university, we have a newsletter, so I can plug in scholarly publishing trends whenever they are short an article. But it also helps keep track of what's going on in our industry, and the word cloud kind of describes what's been going, at least that I've seen in the past year. A lot of joint ventures and pilots, a lot of open access publishing discussions, misinformation, disinformation. The one of my colleagues corrected me on, maybe it's not retractions, at least in the medical world, because that is not good for your scholarly publishing career if something got retracted. So I guess there's a new trend that unless it's egregious, then it's a retraction. But if it's a correction, it might be a republication, errata, correction. So we'll see how the retraction watches and everybody else deals with that, but that was her observation, and thank you, Liz, for making that observation. In our world, National Library of Medicine, the big news, of course, was that Patty Brennan, the director, retired. That was big news. Our Medical Library Association celebrated 125 years. In the Wolters Kluwer world, the fact that their CEO and chair has been on the job for 20 years is kind of unexpected and unusual in our industry, but more power to Nancy McKinstry. Congratulations to DOAJ for its anniversary, Knowledge Unlatched. PubMed reached its 35th million journal citation. And DOAJ, 20,000 OA journals. So there are a lot of things going on. And then even the new products, Wolters Kluwer with its Lippincott medical procedures, annual reviews acquiring the Charleston hub. So there are so many things. TDS Health surprises us constantly with the products that they partner with or re-partner with. They started up again with Ditke that they'd kind of set aside for a while. So I think it behooves us to kind of watch these things. I was telling the person from Cold Spring Harbor about the news I came across about the $10 million archive got for Cornell for its repository. Meanwhile, we've got bioarchive, medRxiv that are kind of sitting there, sisters in a different world. So I think even our vendors, publishers look at what the Joneses are doing, but we don't do it necessarily for competitive reasons, but still it's good for us to know. So I invite you to take a look at the slides, the handout that I have in the repository. See, perhaps you've come across other things, or maybe I'll bring something to your attention you didn't know about. But as I said, some things have come up. Even the Scopus AI tool is now in beta, I believe, and I listed in my handout that it was still alpha. So that's just one example of things that change so rapidly, it's hard to fixate them. But thank you very much for the opportunity. It's always fun for me, but I don't just do it for Charleston, although that's my favorite thing to do, but I try to repurpose what I do, and hopefully you will all get something out of today's session. Thank you.
Thank you, Ramona. So as I said previously, my name is Andrea McLellan. I'm the head of collections and technical services at the Health Sciences Library at McMaster University. Today, I will be discussing values-based budgeting. In this presentation, I will consider collection budgets. I will reflect on challenges facing equity initiatives and look at ways to integrate value and equity-based practices into budgetary processes. Before we begin, I would like to make a land acknowledgement. McMaster University is situated on the traditional lands of the Mississauga and Haudenosaunee nations. At this time, I invite you to take a moment to reflect on the traditional lands and peoples where you reside. We will start by reflecting on the purpose of a budget. In the words of former White House employee Jacob Lew, the budget is not just a collection of numbers, but an expression of our values and aspirations. And VO Key asked us to consider on what basis to allocate funds to one activity over another. That is to say that budgets are about power, and budgetary planning is about causing behavioral change and results. The literature tells us that budgetary success depends on leadership. Integrated planning is essential. No matter what budget model is in place, it is important to align your budget to institutional priorities and strategic plan. The performance measures should link planning to budgeting and to the budgeting process, and these should all align to institutional priorities. Next, we will consider values-based budgeting and be cognizant of the elements at play. Values-based budgeting is about linking budget process to values. Its processes encourages purposeful and mindful spending and ensures that spending reflects values. At this point, we need to reflect on the structures in place at Western institutions to better understand the philosophical and political environments within our universities. Values-based budgeting addresses equity concerns by helping to correct the harm caused by externalized costs of neoliberal accounting practices. Neoliberal policies involve the privatization of public sphere, and equity is moving the balance toward action in favor of public good. Externalized costs is a practice in which companies or institutions show higher profits or cost savings, but society is paying the price for them. So a real-world example of this would be a company that's generating pollution. And an academic example would be allocating budget spending to expensive medical research journals to the detriment of other areas. We cannot go further without acknowledging the nature of university budgets. University budgets are entrenched in neoliberal accounting practices, and they use quantitative performance measures. The university budget process favors stability, which tends to maintain existing power structures. University budgets usually exist in a culture of scarcity, where all resources are allocated and few funds are available for innovation or new initiatives. And I'm sure you have encountered this in your collections work. The solution to moving equity agendas forward in such an environment may be to add an equity lens to our budgetary processes. Equity, along with other dimensions, is already part of library value systems. An equity lens gives collection librarians another approach to analyzing budget challenges. A values-based budgeting model could use equity as a planning framework, and this framework would define how goals will be achieved. The literature notes that most successful equity budgets focus on a few specific groups. In our institution, we have focused on Indigenous and Black populations, for example. I would now want to give you a real-world example from the University of Saskatchewan, which combines values-based and equity-based budgeting. Their model was shaped by Indigenous reconciliation work and is called principles-based budgeting. The University of Saskatchewan chose to interpret their institutional principles through the lens of Indigenous knowledge, which they call GIFts. The 4 gifted principles are sustainability, creativity, diversity, and connectivity. In their path forward, they recommend challenging the current privileging process, including diverse constituencies to revision the budgetary process and foster inclusive and sustainable ways of thinking, using transparent consultation pathways to create a community sustained by horizontal leadership, and using a communication strategy that makes budgeting information accessible across diverse levels of understanding. From their experience, we can observe the emergence of best practices that we may be able to apply to our local environment. When working locally with our stakeholders, we recognize that advocating for an equity model is not without its challenges. It is helpful to acknowledge that our society holds both the values of equity and equality. And within our cultures of scarcity, it is difficult to reallocate funds from one to another. Let's deconstruct this behavior so it can be better understood. Equality treats all people the same, whereas equity treats people differently in the interest of all people having an opportunity for prosperity. As a result, fairness is a natural tension between equity and equality. People may feel that they do not get adequate value for their contribution. For example, as a collection librarian, you may feel pressured to shortchange equity-driven initiatives when faced with collection demands from programs that are higher up on the power hierarchy, for example, research units that generate a great deal of funding for the university. You can mitigate perceptions of unfairness using Kavanaugh's 5 interlocking principles. The first principle is to avoid zero-sum competitions where only one person wins and the other loses. Avoid either-or thinking and encourage both and thinking. It is important to create procedural justice. Decision makers should do their best to be objective and use transparent procedures. It is helpful to decompose outcomes to intermediate and ultimate outcomes. This technique is particularly useful for libraries because it recognizes that ultimate outcomes of an institution often exist outside of our control, but we can forge partnerships and we can influence factors. And finally, engage in discussion. Trust will be built if there is agreement about values and priorities, transparency in decision-making processes, and accountability for results. To summarize, the values-based, equity-based budgeting literature recommends that we seek diverse voices and use a dialogic approach to consult broadly with constituents. We can create a resource inventory and ask ourselves questions like, how does the proposed expenditure expand opportunities and access for individuals to a needed resource? And during budget cuts, we may ask, will the cut make existing inequities worse? Will it reduce access? Importantly, we can develop equity-based performance indicators. We can reconsider measures of success to include qualitative approaches that demonstrate living impact of values-based budgeting. And we can use Kavanaugh's 5 interlocking principles to navigate difficult discussions. Here are my final thoughts. Collection librarians feel the pressure of emerging technology and the demand to support the existing power structures, for example, medicine and research. In this environment, it is challenging to support equity and values-based frameworks and protect the interests of marginalized, disadvantaged, and oppressed groups. We need to think critically about utilizing new tools. Some of these approaches are already in our wheelhouse, but they need to be implemented purposefully and mindfully. We know that deep structural transformations are needed in our institutions. We can use these tools to nudge our units in the direction of equity, diversity, inclusion, and decolonization. And finally, leadership is key. Good leadership fosters different behaviors and elicits participation in new ways of thinking. I have a reference list for you, and I will post a model on privilege that I encountered in another environment recently for anyone who's interested in a privilege coin model. And that's the end. Be happy to take your questions. There's one back there, Kim.
Could you just go back a slide? Because I typed in Kavanaugh's 5 linking principles and you don't want to know what I found. And I just need to get a copy of the citation.
Oh, It's the basics of equity budgeting. Okay, thank you. Oh. Yeah, the majority of my my literature is coming from the accounting area. So I went into the accounting literature to get all of this. And if you're in, libraries don't show up. I mean, a lot of the values-based budgeting is speaking to, we value making inroads in South America, so we're going to sell. And so it's from that perspective. And so don't be surprised if you are investigating some literature that you're not gonna encounter library literature there. It's based on different models.
Any other questions for Andrea? Yeah.
Oh, there's.
Hi, Andrea. So I wondered depending on who at your university determines your budget, would you ever find, like, let's say the provost is deciding how much money the library gets, or the med school dean, or somebody, what if they don't really have the same values, and sorry, I'm not.
No.
Just the idea is they're deciding your budget, and so at a certain point, like I, as like the head of collections, am needing to do what the person who gave me the money wants me to do with the money. I have some leeway, but then how far can I go afield from what they want? Just any thoughts on that?
So I think that there are probably individuals in this room who live in states where there's legislation that prevents investing in certain areas. And if your university has values that you can link your actions to, then I think you're safe, because you're protected by. But if your institution itself is not supportive, then I think you need to be creative about the way you do that. And I think that Kavanaugh's is a useful structure because it does mention that both and. So are there things we can do that is going to benefit the group that I'm trying to target, a marginalized group, or can I reframe this purchase to benefit the groups that do hold power in my institution? So it takes some digging to figure some of that out, and probably building some strategic partnerships or relationships with people who are in positions of power within your institution. And it's not easy. Like, it takes a lot of work, right, when you're in a position that you're working against the tide.
I think we can do one more question, and then if you have more, hopefully we'll have time at the end.
Thanks. I'm Holly Nardini from Yale University. I'm curious about the qualitative measures of success that you mentioned, and if you have one or two examples of the kinds of things that might be new.
So the qualitative measures and a lot of work was that a lot of the content that I gained value from came from the Carter article from out of Saskatchewan. It's very useful if you're interested in just getting links to all kinds of useful articles. That it's a foundation. But one of the things that Carter and her group talked about is reframing sustainability, for example. In our institution, sustainability typically means money. That is not the way that the Indigenous community in Carter's institution would interpret. That's people is sustainable people, sustainable environments, and the sustainability is brought much larger, and it's reflected in lots of international governmental, non-governmental agencies, sustainable development, like all of those. So you can point to broader definitions, and they're going to be measured differently. they're not just a number. And I think developing some of these measures is going to be the next step, because we have to come up with measures that are reliable and valid, right? In research, those are the two things. And in qualitative research, it's building up the expertise in the area and ensuring that everyone agrees on the definition, and it means that you're bringing in the people from those communities to define that, which as librarians, we're used to having power and control. We're dealing with bigger power structures above us, but I think that many of us might be reluctant to broaden some of that discussion, just because, oh, great, now everyone, suddenly this whole huge community is defining how I'm going to measure this. And that's a challenge for us to deal with personally, I think. All right, so I am going to put up Elizabeth's final slide because it has her information, and I'm going to switch to her presentation.
Welcome to Community-Focused Approach to DEIA Audits and Collections and How Institutional Values Shape Publisher Negotiations and Open Access. Before I begin, I feel it's important for people to know that on June 17, 2023, the Governor of Texas signed Senate Bill 17, which bans diversity, equity, and inclusion, or DEI, offices, programs, and trainings at publicly funded institutions. This bill will take effect on January 1st of 2024. And since I work for a publicly funded institution, there have been some changes that have taken effect on my campus to include some of our language, which is why I want to welcome you to a focused approach to community representation and global equity audits in collections and how institutional values shape publisher negotiations and open access. I am Elizabeth Speer, the Associate Director of Digital Scholarship for Gibson D. Lewis Library at the University of North Texas Health Science Center at Fort Worth. So the goal of this type of audit is to promote community representation and global equity by evaluating the collection and integrating resources that reflect the people we serve and the values that we as an institution or library embody. So how do you do that? Well, the easiest way to do that is to use the tools that you have at your disposal. And this bulleted list that you see here on the slide are the tools that I utilized in the work that I have done on making our collection more equitable and more representative of the community that we serve and more representative of the values of which my university works through and embraces. So you'll notice they're kind of divided into three sections. Section 1 are going to be tangible physical things. Section 2 is tools that I have that allow me to view what's actually within the collection. And the third way is how we actually implemented the changes that we were making into our collection and through our communications. So you'll see that the first section there is the view book, sometimes called the fact book or lookbook of my university, a tool called Policy Map that we subscribe to, which collates data from different state, local, and federal government agencies, the HSC website to identify our research and community partners. And then I started looking through other things. So I'm just going to move on and explain it as I go. So the first thing I had to do in order to make this effective was to determine who my community was, because it is impossible for you to do a true audit that is community and values focused without understanding who your community is. So I used that lookbook or fact book to get the information there that you see about HSC, including the number of staff members we have, how many faculty, how many students, what the demographic looks like of all of those people, the increase in our Hispanic population, the increase in our African American population, and gives me a better general holistic view of the university. Then I used Policy Map to actually pull in the Fort Worth area demographic data, and I looked at the communities that we have within Fort Worth. And while it is predominantly homogenous, with most 64% being white, that is not true for that remaining percentage is quite varied. And so we needed to know that. I also, though, looked at further abroad in areas where we do some outreach. So how do I know about that outreach? Well, that's when my website for my university came in handy, to where I could see where we were doing research that affected our community. And that includes this Texas Center for Health Disparities, Center for Healthy Aging, and other areas, including rural communities and transgender healthcare. So all of these things would determine who my community was and how my collection should represent that community. So utilizing that information, collection evaluation began, and those terms are actually based on the selected communities that we serve. So when that occurred, that's when I went in and searched the discovery layer, our visual databases from the A to Z list that don't resolve well in our discovery layers, our individual subscription titles, title lists from databases, looking at book content, and pulled interlibrary loan request data for topics in areas of need. That was a whole lot of work, and doing all of that information then told me kind of where holes were. So I started looking at, okay, I know I need more information on, say, transgender healthcare, because I wasn't seeing that. So selecting my collection evaluation terms based on the community allowed me to focus on the community, and then also focus on the values that we utilize as a university. So one of the things in this process was actually to create a list of all of my vendor representatives, and these are just a few of the vendors that we regularly do business with. And the reason that I did that is because once I knew where my holes were going to be in areas that my collection needed to expand and become more inclusive and community representative, I was going to have to communicate some of this information to my vendors to make my job in locating resources to fill these holes and to expand our inclusivity. I couldn't do it without their help. And so I needed to make sure that I had a complete and comprehensive list of my vendor representatives so that I could begin the process of speaking to them. Now, all of this has to fall under the values of my university in order to be effective, not just short term, but long term, because evaluating your collection to ensure that it is inclusive and it is diverse, which I'm not really supposed to use that term, but I'm going to, and that it represents your university or your library or wherever it is that you're working, so that you're integrating your values and you're looking at your community that you serve and you're making that all work together. You have to understand what your values are. You have to understand how to make them work for you. And you need to ensure that your policies and procedures reflect your values and library goals. So we actually changed our collection development policy and evaluation criteria to force values into our workflows. And you'll see there on the left-hand side of this screen, those are the values of the University of North Texas Health Science Center at Fort Worth. And they are courageous integrity, be curious, we care, better together, and show your fire. And you'll notice that there are arrows that point to individual items. And those items that I have highlighted there with the arrows and the giant circle around better together are the pieces that allowed me to make this audit work within our value system. So you'll notice, especially in that Better Together, it says develop awareness and understanding of different experiences, respect diversity of people's beliefs, thoughts, and ideas, support opportunities to remove barriers to equity and inclusion. What this means for us is that these things are not suggestions, they are requirements, and therefore we changed our policies and our criteria to integrate these values into our collection development policy and into our audit policy. So once you've figured out where your holes are and what it is that you're trying to do and who your community is and what your values are, and you're sure that you know what you're working with, you need to establish values-based expectations for negotiations with your vendors and communicate them very clearly. For me, this meant meetings with all of my vendors, emails to everyone, and a very clearly written letter outlining our expectations. Vendors should then be required to provide a statement on how the product or their company meets these expectations and specifically supports the values and work that you are trying to do. We found that the letter was the most effective way of communicating this information because, first of all, I had proof that they had received it and then forcing them to acknowledge the receipt of this and understanding of what we were trying to do and what our values were and what our expectations and negotiations and communications from them were. That all came through them providing that statement, and it opened up a new level of conversation and honesty with each other when we were communicating. And I would be happy to provide a copy of this letter to anyone that would like it. My contact information is available to everyone, and so you can just reach out to me and I will happily email you a copy of this letter. But very quickly, it basically says, in our continuing efforts to live our values, abide by our code of culture, and influence change, Gibson D. Lewis Library has immediately implemented the additional criteria of community representation and global equity for evaluation of future and current purchases of academic and clinical resources. And then it continues on from there. This is not the original language that was used. Originally, it did say diversity, equity, and inclusion. It has been adjusted to reflect the state requirements for my university at this point. So how do values enter into open access negotiation and open access materials? Well, actually, they're the exact same values regardless of what you're doing. They're integrated into vendor negotiations in the same way, and they apply to open access read and publish agreements. They help me ensure that our open access agreements support the publishing needs of my university, and they should do the same for your university. It does not make sense to enter into an agreement simply because you can if it is not supporting the values and needs of your university or library. It also helps to leverage your values to support OA and OER across campus. We care and better together, as I said, means that not only the audit for inclusion is a requirement for my work, but also that open access is a requirement for us and not an option. It very clearly says that I am supposed to support opportunities to remove barriers to equity and inclusion. In We Care, it says I'm supposed to share experiences and resources, and what better way to do that than through open access and open educational resources. So my values have actually made my work in these areas easier. It has allowed me to very clearly, if there's ever a question about, well, why are you pushing this? Why is open access so important? Why should we care about open access? It's more expensive to publish open access. It's this, it's that about open access. I'm actually able to pull our values out during the negotiation or conversation processes across campus and with vendors and say, look, our values say that this is something that we are supposed to be doing, not something that we maybe should think about doing. So I think that understanding your values and how you can utilize them in a way that supports the endeavors which are important to you in your negotiations and communication tactics is really important. And I know that was a lot of information that I went through kind of quickly, and I'm sure people have questions. So my email address and phone number are there. I will be happy to answer any questions that come through. Thank you.
So since Elizabeth isn't here, I mean, you can certainly email her, but if there are any thoughts or questions that people want to bring up or just have like a little discussion, we can definitely take those and either bring them back to Elizabeth or other people can chime in.
Does anybody else in their states or institutions have the challenge that Elizabeth has, having to change their vocabulary? Well, you're from Texas, so.
Yes. I mean, the fear is very, very real. I mean, the state's run by people who don't like diversity, equity, and inclusion. The provost is telling us we have to remove anything that is remotely diverse related. And so it's a tough challenge. And so they're currently working on curriculum changes at the moment.
Any other thoughts to share? Okay.
All right.
Over to Elias.
So, buenas tardes. Good afternoon, everyone. We would like to start by thanking Andrea, Kimberly, Ramona for inviting us to be part of this talk today. It was about a year ago when, thank you. It was about a year ago when ChatGPT changed the way we think, or most of us think about AI, right? So December of last year, January 2023, my boss, Chris, and I were talking about what does this mean for us, for what we do? What does it mean for libraries? Because of that, we decided to write an opinion piece about the implications of ChatGPT for academic libraries. And because of that, we have been engaged in conversations, presentation like this one today. So for the next 10 or so minutes, I will start with an overview of the impact of AI in healthcare. Then Chris will talk about the opportunities and challenges that AI brings to the healthcare industry over the next few years. I will end with a list of ideas on the role of academic libraries to support the training and education of healthcare professionals. So I think it's fair to say that when it comes to AI, there's some good news and some bad news. The good news is that it can be a game changer. It is a powerful tool. For the healthcare industry, AI has the potential to help with the shortage of healthcare professionals. The bad news, AI has many black boxes, which can lead to some harmful decisions. We've heard about issues, questions about privacy, ethics, and bias. Given all of that, we also know that there are many AI-powered systems and applications for all kinds of industries. In healthcare, it is generally believed and expected that AI tools will facilitate or enhance human work. So these tools and applications should assist physicians, nurses, and other healthcare professionals to be more efficient in what they do. Over the last few years, there have been a number of AI initiatives that have changed and improved healthcare services. So on this slide, we have 5 examples. So for the first one, medical imaging is very important in the diagnosis and treatment of many diseases. but the interpretation of medical images is often time-consuming and subjective. So AI algorithms have been developed to assist in the analysis and interpretation of data from medical images. For drug discovery and development, a good example would be how AI is being used for drug discovery. It's AlphaFold, which is an AI system that can predict the three-dimensional structure of proteins. Personalized medicine. AI is having a major impact on personalized medicine, making it possible to develop and deliver tailored treatments to patients based on their individual genetics or individual profiles. So these days, there are many wearable devices, right? And that's part of what it's feeding these systems. Another example would be the development of digital twins, which are virtual representations of patients' bodies and organs. So these digital twins can be used to simulate the effects of different treatments on the patient before they get the actual treatment. In terms of disease prevention and management, one example is the use of AI in the management of diabetes. AI-powered monitoring systems can track blood sugar levels and provide real-time recommendations for insulin dosages, diet adjustments, and lifestyle changes. And finally, for administrative tasks, AI chatbots and virtual assistants can provide information to patients. I'm sure many of us have already interacted with some of them. We call our doctor offices and we talk to a machine before we get to a human. With that, I will turn it over to Chris to talk about opportunities and challenges.
Thanks, Elias. So when it comes to opportunities, you can see the first one we're talking about is diagnosis and treatment planning. In many cases, we talked about, or Elias talked about the fact that you have medical imaging, you have an x-ray, you have some sort of MRI, and that compares to other ones you've had before and to other people who have had ones before. And you can have AI now and analyze all those things and determine, even maybe better than a doctor can, what the diagnosis should be. A lot of people are involved in the treatment of an individual. They take a lot of notes. Those notes are all over the place. New people come in, they don't know what's been done previously, or the notes are difficult to read because these are doctors. And so as a result, you can have AI interpret those notes and determine an overall diagnosis and strategy. Another example is it can look at vast data sets. It can look at your genetics. It can look at your background. It can look at your genealogy and figure out what has this person been through, what is his family background or her family background, and how does that impact the diagnosis and treatment. And the last thing is it can help, as Elias mentioned with this digital twins idea, is you can then compare and tailor that treatment to a specific patient. Predictive analysis. So when COVID was hitting, we had a lot of ways we were trying to figure out whether COVID was active in a location. We were looking at wastewater. We were looking at hospitalizations. What if you could look at social media posts? What if you could look at absences at work? What if you could look at all those other things, combine them all, and determine where there are hotbeds of new diseases that might be coming up, new types of health issues that we might want to address. And AI can help to predict those. They also can predict your individual medical risk. They also can help healthcare systems optimize resource allocation and staffing levels based on what it sees in terms of trends, which are difficult to see when information is all spotty and everywhere. It can help with, as it mentions here on the slide, drug discovery. So with drug discovery, what we mean is that we want to know how drugs interact with the human body. We want to know whether those drugs are going to have a positive or negative effect. Testing them on humans is challenging. Right? You have to do a lot of testing before you get to a human body to be able to test a drug. It would be great to do that digitally and determine what that feedback, what that response might be, so you could avoid reactions. You could avoid harsh side effects as part of this. Virtual assistants. Already you use Siri. I said it right, so it's all good. Come on. As virtual assistants, but you also could do that in that you can talk with those virtual assistants as a doctor. So you have interns running around. Now you maybe have a virtual intern, or you can work with them in terms of just interacting with doctors or with medical professionals. And the last thing is personalized or remote medicine. So we talked about how many of you guys have a Fitbit or some kind of wearable device, Apple, right? Where does that data go? Like, does Apple have it at their house? Like, does the head of Apple look at that stuff and say, oh, she's got hypertension. She might want to buy, I don't know, whatever new Apple product they come up with, right? So one of the things we'll talk about when it comes to challenges is who's got that data? Where does that data live? I'm voluntarily giving that data because it helps me, but who else does it help? And that's a big question. So, but those wearables are interesting because they can track all that data about you and determine whether that's a benefit or not. So when it comes to challenges, I talked about data privacy and security, right? First of all this health data that exists in hospitals, exists in doctors' offices, it's a treasure trove of information which hackers would love to get a hold of, right? So there's the opportunity for data breaches or misuse of data, lack of transparency because we just mentioned before, where does the data go that's collected? There's not a lot of regulatory ruling on this right now. There was a recent White House executive order on the safe, secure, and trustworthy development and use of artificial intelligence, which talks about harnessing AI for good and realizing its myriad benefits, but that means mitigating substantial risks. And so one of the things we need to figure out is how do we handle regulatory situations, particularly when we're not just talking about a town, but we're talking about a city, we're talking about a state or between states or a country or worldwide. And every one of those may have different rules, as we learned when we talked about diversity, equity, and inclusion, right? So how are we going to have these conversations? How do we train AI to be able to talk, basically talk medicine, right? And figure out how to have these conversations. Bias and fairness is another challenge, right? The data that's put into these systems is put in by biased individuals, which all of us are, whether we like it or not. And so as a result, the bias is going to carry forward into the machine. You've all seen these things where they have facial recognition, but they don't work well on every skin tone, right? So we have to be careful of these biases and make sure that not only do we kind of weed these out and identify them and make changes to the systems, but we also have to make sure that vulnerable populations are not eliminated from these. You know, their diagnoses are as important as everybody else's. Of course they are, so they have to be part of these systems. They have to be involved in these systems. And there has to be some understanding of this black box where all this data goes. Ethical concerns, right? How is this data being used? Some patients are going to be upset by the loss of control, and they're not going to understand what's being collected and why it's being collected. And many times we don't actually sign off on this stuff, at least in ways that we understand, right? I guess if we buy a Fitbit, somehow we've now signed on to share this data. But I don't remember signing anything when I did it, but who knows? Maybe I did. And workforce adaptation. So understanding AI and ChatGPT. It's something you're all doing in your jobs and you're trying to understand what it means. And one of the challenges there is some people are worried about it might take their job. Other people are worried about the skills gap. Other people are worried about exactly how they can utilize this tool for their best, to make their jobs better or easier, or maybe they don't have to do certain parts of their jobs anymore. And that involves a lot of training. So speaking of training, I'm going to turn it over to Elias to bring us home talking about how this applies to medical libraries and medical training.
So now that we've heard about the pros and cons with this technology, the question might be, so what's next? What do we do now, right? Let's remember that libraries have always provided access to services that support different types of learning. So given the current opportunities and challenges with AI, we have an opportunity to continue to adapt and align our services to what students, faculty, researchers need. So specific activities that libraries can do, and many are already doing to support AI initiatives, will include what we have on the screen. Providing access to AI resources. So academic libraries can play a vital role in providing access to these type of resources for the training of future healthcare professionals. I think a first key step would be to support AI learning opportunities for our team members, for librarians. And then once there is a group, they should curate a collection of AI-related resources, which would include relevant software tools. Ensure that students and faculty have access to databases and journals specializing in AI and healthcare. So I think conferences like this one, it's a great opportunity to connect with vendors and see what's available. And then negotiate trials, right? Demos, perhaps agreements. Open access, it's relevant to AI, so we should also continue to support open science principles, which are essential for more transparent and equitable practices. And I might skip a couple of these because of time. Are we? Collaboration with faculty and researchers. So working with campus groups, it's very important. So think of centers for teaching excellence, research offices, information technology, centers or institutes that work on ethics, open science, inclusive education. Together, we advocate for collaborative work and create opportunities for learning, which could take forms of forums, workshops, webinars, or conferences. Finally, creating research guides or modules. So yesterday, we've heard from several presenters that there is a need for more information literacy and AI literacy type of training and education. So as we continue to expand our offerings for library literacy resources, it will be important to also create research guides or modules that will help explain the benefits of these new tools, as well as step-by-step information on how to use them. Very lastly, assessment will be even more important. In times like this, with limited resources, data-driven decisions, we have to show that, hey, this is working and this is why. Otherwise, it might sound good, but we might have to look at something else. So for further discussion, conversation on this topic, I'm sure you know the National Library of Medicine has a number of resources. They had a webinar just last month, 2 weeks ago, as part of their Health Bites training program. Also, the Medical Library Association hosted a free webinar just last week about how to assess toolkits or tools for AI programs. So with that, thank you. And do we have time for questions?